So, can you give me your name and the place where you're working?
Hi, I'm Derrick Chen. I'm working at the National Taiwan University Bei-Hu Branch.
Yes, a very small hospital. Can you describe a little bit how many beds and how many people there are?
Yeah, sure. This is a branch hospital. I'm the superintendent of that hospital. And then we have only 300 workers. And then even though it's a hospital, it's only have 30 beds.
Oh, okay. But you're part of how much is the big hospital?
Okay. The big hospital called National Taiwan University Hospital.
Yeah.
And that big hospital have close to 2,600 beds.
Yes. And how many patients do you do a day?
In
that big hospital?
In the big hospital, okay. In the big hospital, we have outpatient roughly 10,000 outpatient a day.
Yeah, we think amazing. And how many doctors and how many nurses?
In that big hospital, usually we have 800 attending physicians and about 800, training physicians.
Yeah.
And then for nurses, we have about 3,000 nurses.
Yeah.
And the total workers about more than 12,000.
Yeah. We have to ask because everybody's always amazed, but how many patients does a doctor ever see on a day?
If outpatient, I think for average doctor, each session about 3 hours, maybe 30 to 50.
Okay, so about 12 patients an hour.
Yeah,
so
yeah,
5-6 minutes.
Roughly.
And sometimes a doctor sees 100 patients
Yeah,
in
yeah,
a day.
yeah.
It's just the efficiency is amazing.
Yeah.
And you're an academic hospital. You also do education and
Yes.
that kind of stuff. How can you be so efficient? I mean, how come that this hospital is able to be so efficient?
Well, it's basically by training because the healthcare system they kind of train us to do so. Of course, initial visit it becomes maybe for me, I'm a geriatrician, so initial visit maybe 20 minutes. But then after that, when you come here only for review, usually they'll say, "Hi, grandmom, are you okay?" And then he said, "Okay." I said, "Good, bye bye."
Yeah, you're trained to do it.
Yeah.
You need to do it because otherwise you don't know because you get paid also per people can come to the to the hospital. They can get an appointment. They don't have to wait much.
Right. In this hospital, in this country, basically you don't need to have a referral to see a doctor.
Yeah.
So you don't need to go to primary care.
Yeah.
So if you want to see a hepatologist, you can just go there appointment.
Yeah. And the average doctor here, how many hours are they in research, and how much are they in education, and how much are they clinical?
Okay. So it really depends. In the main hospital, what we mean is a medical center.
Yeah.
So we are obligated to do research. So for me, I'm a clinical professor. So I may have 25% of the time, or maybe more, to do research. But on the other hand, my branch hospital, it's a branch hospital.
Yeah.
We're a local hospital.
Yeah.
So it's not required. All the physicians need to do research. So if you want not to do research, you don't need to do research. And also, if you are opening a clinic on the street, and you don't need to do research at all.
Yeah, right. Talk about innovation. You need to become efficient. There's always a pressure to be efficient.
Yeah.
AI, is that already something of interest to you?
Sure.
And what fields are you using it?
In this big hospital, of course, we are doing a lot of research. So, of course, there are a lot of programs that try to make things easier for everyone.
Yeah.
I think in the meeting we mentioned that there's ICD-10 coding system that can help the coders to identify correct code from the discharge summary. So initially they only do it from the eye. Right now they can identify, so they can save 14 or 20% of the time. That's one good example. But of course, not everything is that good. Or if there's something can help you to identify the lung nodule more quickly, something that can be good. Right now, in my small hospital, we are trying to do something it's something already commercialized because there are some new reimbursement rule from health insurance saying that for certain disease, if you have osteoporosis with certain disease, they have reimbursement of the medication. But if you want to do that, you need to pay for the DEXA scan first. There's some AI that can help you identify someone has high risk.
Okay. So triage with AI.
Right. Yeah. So in that case, if I tell the patient, if you do that, then you pay for yourself, then it's probably more efficient. So we're trying to do that.
Okay. So that already helps to prevent the talk to that. Is there also that if you talk with doctors and doctor and patient, is that already that AI listens in and makes the transcript totally done? Is that already being researched?
That there are some software, but we have not implemented that. The main issue is that even the software is ready, to use that, you need to incorporate into the existing system. The difficult part is to incorporate.
Software is ready, but I thought that taking new stuff into the system goes very fast in Taiwan.
Yes or no? Because it's for safety issue. You probably
privacy and not making
know
mistakes.
that there are a lot of attack from outside. So every step for the medical informatics need to be very cautious.
There's a lot of hacking from mainland China who tries to get in there.
So it's not really the technology per se. It's really how can you incorporate all the things into the system.
The quality is good of the software to listen and
I'm
to
not sure.
what
I'm
is-
not sure because I have not.
Okay. What other things are used? What other new things are new innovations do you see coming to your hospital?
We also have a research project. It's trying to do the macular degeneration and also do the diabetic retinopathy, a screening without the ophthalmologist. Otherwise, it's very difficult to get an appointment for the ophthalmologist. That part is coming.
Okay. And also remote care. Do you do a lot of remote care and home testing? And those kinds of things?
The remote care part is not because of technology, it's because of policy.
Oh, policy. Okay.
Because there are some reimbursement issue for the health insurance. So and then if you want the patient pay everything out of pocket, it's really difficult because right now,
nobody wants to do that.
So.
AI in general, you as a doctor, do you play with ChatGPT or all kinds of other little
if I have time.
If you have time. This whole thing about life balance, life-work balance is difficult for doctors. I mean, everybody's very happy about the healthcare system, except for the doctors. They're
I also
very unhappy.
have Saturday clinic, so
Oh, you also work in a clinic?
A Saturday clinic.
Oh, your aesthetic clinic also. Okay,
so
you have many jobs.
Very
And you also have a family. I can imagine. I know you need to go. Thank you very much for this information.
Thank you.
Thank you.
Take care.